Hi everyone, it's Laverne. I'm back again. As promised, in the first video I stated that this video would give you a little background on when the diagnosis of dementia came about, how it came about, and signs that we didn't really pay attention to in the beginning, and I'd like to give you those helpful hints to maybe pay attention to them. And by no means am I a medical professional or know anything about that, but not realizing now that maybe we could have caught it a little sooner is something I think about, but it's caught and we're working with it. So in COVID in 2019, as we all know and experienced, my mom wound up with COVID, very severe. She filled with clots. She did pass on the table. They were able to bring her back. She had an amazing internalist who did an amazing job and brought her back. So after rehab, she came home. And so we had started to notice just couple little weird things. My grandmother had passed away previously, about 16 years before, and she just kept recognizing that she needed to go home. She needed to see her mom. And it would come in small increments. And we started to notice the oddness of this. So we mentioned this to her primary care happening, that it just didn't seem right. So they did do a head CT on her. They noticed that what she had was, I believe, I'm trying to recall from memory, was in the front, and it did show a little bit of damage, but it was not Alzheimer's, it was dementia. So at that point, we had a regular primary care for her. At that time, and I would recommend it, we did switch her to a geriatric specialist or primary care that deals with Alzheimer's and dementia, just because they would understand a little bit better and have a little bit more advancements with that. So we did switch her from a regular primary care to, like I said, that geriatric specialist. So it is something you should consider if your parent or family member is not seeing someone based on the disease. It really is important, and it also helps you to understand a lot of things too, and when you go to visits. So we did switch her there. Once she had her initial visit with this doctor, she did an assessment in the office. And unfortunately, my mom failed. She wasn't mid-grade yet, but she was in a little bit more of the beginning stages, a little further into the beginning stages of dementia. She wasn't able to remember certain things. The doctor said things to her like, remember these colors, this name, and then again asked her what she had said. About 2 to 3 minutes later, my mom could not remember. So those are things that just give an eye out for. We also, previous to her getting COVID, she was an active woman. She worked her whole life. We didn't really notice that small things were happening, and now that we look back, we probably could have noticed a little stranger. Like, she'd forget where she put her keys, and that just seems things normal as we get older, correct? I guess. And but then she would all of a sudden mistake in something that should have been in a cabinet into the refrigerator. Miss birthdays, or not be sure of birth dates, and again would mention my grandmother as still being here, needed to call her, needed to talk to her. And then she'd seem to like snap out of it. So because she just mentioned certain things, you figure, oh, she's having a moment. It's coming close to my grandmother's birthday, or it's coming close to Mother's Day. She must just be missing her. Or, she has a lot on her mind. She probably just didn't mean to put the peanut butter in the refrigerator because we don't do that, But so those are things that kind of pay attention to. Pay a little bit more attention to the odd things that they start to do. And again, there's no time frame. People as young as 40s get dementia. So I can't say to you, well, they're going to happen at a certain point. It doesn't. Like I said, it was COVID that did bring it out. There was things after, like I said before, prior to this, but COVID brought it out. And just as a reference, my mom is now going to be 77 this year. She started at 72, probably a little earlier too. But, with COVID and everything, it was around the age of 72. So it's just a little background for you to say. But one of my major things is, if you are dealing with it, I personally, again, it's just personal opinions, find it easier to deal with a geriatric dementia primary care, or a primary care dealing with, doesn't necessarily need to be geriatric, but a primary care that's very well versed, if not specializes in dementia, Alzheimer's, because they have a better understanding and very compassionate to the understanding of the family as well as the patient. So that's my second video. I will go on to get to the next set of videos explaining how it took some time before we were able to find out about benefits for CNAs, for home health care, for also for incontinence supplies, because that's started to happen. Also, meal services like the Meals on Wheels. We knew nothing about any of this. So we went for almost 3 years doing all of this myself, my dad and I. And it really, it's been a blessing now that we have it, and I'm so appreciative of it. And I have great CNAs, I have great health aides that come in, but God, it would have been so much nicer to have it a little sooner, you know? So I don't like to see people without that knowledge. So like I said, again, this series is just really personal, just to help somebody, even if it's just one person, understand and be able to go get that help that they need for their family member or parent, or, you know, maybe even just a best friend or something. But to know where to go. References are so important, and it will help you. It helps along the process. So that's it for now. I will do up another video hopefully tomorrow, and like I said, touch upon where you can start to go for services, because they are going to be needed for you as well, believe me, as the caregiver, as a caregiver assistant, as just a family member. They're going to be needed, because it's hard. It really is hard, I will say, to watch your person that you're caring for, whether it's a family member, a good friend, whoever it may be, just diminish and start to forget the basic things, and know eventually they're going to forget you as well. And so you just have to remember all the good times and stay positive about all of that, and just know it's a disease, because obviously they would not want to forget you. So till we talk again, you have a wonderful evening, and goodbye all.